to fund your future with DRS. Now, when you separate from public service, either to retire or to go work in the private sector, you might have the option to cash out your vacation leave and sick leave. And depending on where you work, these cash outs could be paid out to you in account for medical expenses that can be used in the future. And there's quite a few advantages to doing this. It was a great program, and we've invited Brian on the show to tell us a bit more. So welcome, Brian.
Thanks, Jenny and Seth. I've listened to quite a few podcasts in my day, and this is my first time actually being on a podcast. So I appreciate the opportunity here.
That's perfect. Yeah. So just to start, can you tell us a little bit about the work that you do? So you work for HRA, VEBA, and tell us a little bit about this program and kind of what those acronyms stand for.
Yeah, for sure. I've been working with VEBA plans for the past 20 years. We work with public employers and employees to help them save for their healthcare expenses. And most people think of HRAs and VEBAs as an account to help cover retiree healthcare expenses and premiums. And of course, the IRS likes to use acronyms. HRA stands for Health Reimbursement Arrangement. And I'll tell you what VEBA stands for. It's not going to explain a whole lot. I didn't come up with the term. It's the IRS, but it stands for Voluntary Employees Beneficiary Association. And it's basically a type of trust that holds these benefit dollars.
So, Brian, we've had some folks on the podcast previously to talk about health savings accounts or flexible spending accounts. Could you explain to us how these HRA and VEBA accounts are different than health savings accounts or flexible spending accounts?
Yeah, it's kind of an alphabet soup, lots of acronyms. They're all tax-advantaged health accounts that have different rules. So I think they're all good plans. They all just have a different kind of niche. I'll start with HRAs or VEBAs. HRAs are technically funded by the employer or by mandatory employee contributions. And the most common way that VEBAs are funded is going to be with a sick leave cash out upon retirement. And depending on where you work, there may be other funding methods in place, such as monthly contributions or annual contributions. HRAs can be used during employment if you have an account during employment, and can also be used in retirement. HRAs are most often used for copays, prescriptions, deductibles, and of course, retiree premiums and Medicare supplement premiums. Now, moving on to the HSA, Health Savings Account, that's a little bit different. To contribute to an HSA, you must be covered by a high deductible health plan, or HDHP, or sometimes it's called CDHP, Consumer Directed Health Plan. And you're allowed to contribute to $4,300 if you're just covering yourself, or $8,550 if you're covering a family. And you can use the HSA for things like copays, prescriptions, but generally not for retiree health insurance premiums. And then moving on to flexible spending accounts, or FSA, that's another type of account employees can use. The FSA can be used by active employees for this year's out-of-pocket healthcare expenses. So FSAs are a use it or lose it plan where employees are going to need to use the funds that year. And then they may have a grace period to use the money into the next year, or a certain amount that can roll over into the next year, but should generally be just for that year's healthcare expenses.
Yeah. And then so kind of switching back gears to, of course, HRA that we're talking about today. If folks are kind of in that point where maybe they're getting ready to retire, or I think a lot of times people think that HRAs, it's just for those who are getting ready to retire, but it's also for those who are just separating from public employment, right? And how would someone, if they wanted to enroll in this program and roll over their annual leave or vacation leave, how do they enroll?
Okay. Yeah, good question. In most cases, the employer would enroll the employee when they become eligible for a contribution. So for many people, that's going to be on retirement or upon separation, or if someone works, let's say at a city or county where they're getting ongoing monthly contributions, that the employer would enroll them when they're eligible for that contribution.
Okay. They would need to talk to their HR department and say, hey, I would like to take advantage of this program to be able to roll over my vacation leave.
Mm-hmm. Exactly.
Okay. Perfect.
And Brian, help me, we didn't prep this question, but I know I've had some questions from people who are close to retirement. And they've said something about like their employer takes a vote, or like the people who are eligible for VEBA take a vote. Does that sound familiar to you as far as how employers decide whether or not they're participating in these programs?
Yeah, so it stems from the IRS rules on these plans. Basically, the big rule the IRS has is that there's no individual choice. So group they might vote on this. So yeah, very common to have those who are eligible for the contribution vote on this. Maybe annually or every couple of years. Maybe they bargain for the contribution, or maybe it's just part of their policy that they participate. So there's different ways to decide to participate, but the big rule is that it's something that the employer or the group would decide on, and in a vote is very common.
That's helpful and makes sense. And I think to Jenny's earlier question is really why you want to go talk to your employer. Do you have this available? Is this something that is going to be that you're going to use when you retire? Some employers may have it, some employers may not. DRS can't tell you whether or not your employers are participating. So yeah, that's really helpful. And then so let's say the employer is participating, person's about to retire. They've got a balance of their sick leave that they're going to cash out and move into this HRA VEBA account. Can you just tell us like the mechanics of how that works generally?
Yeah, so let's take an example of let's say a state agency employee. So state agencies, the only way they participate in VEBA currently is with a sick leave cash out upon retirement. So let's say you have an employee who's, state agency employees are eligible for 25% sick leave cash out of unused sick hours when they retire. So let's say someone has 1,600 hours of sick leave. He would end up getting a cash out for 400 hours. So 400 hours times daily rate, hourly rate. So let's say in this example, hourly rate is $40 an hour. That would be about a $16,000 account. So tax-free that he could use for healthcare expenses, premiums, copays, things like that. And having VEBA in place, you don't pay the income tax or payroll taxes. So that, going back to this example, $16,000 sick leave cash out. If for some reason VEBA was not in place and he just took that as taxable wages, would probably end up getting somewhere closer to $11,000 after those taxes are taken out.
That's significant.
Yeah, that's really significant. And in your example, $16,000 could go a long ways if you're using that just to pay your medical premiums I'm forgetting what the state healthcare authority premiums are off the top of my head, but I think for people who are over 65, it's a couple $100s a month. $16,000 could have a significant impact for how long you're able to cover those premiums.
Yeah. And I guess that kind of goes well to our next questions. Once you retire, you have this account with HRA, say there's $16,000 in there. Can I then put more money into that account after I'm retired?
Yeah, so as far as how money's contributed, it's generally contributed only as you're working or as you retire.
Okay.
You're not allowed to just add your own funds to the account. There's an exception for that with COBRA. So if you were getting a monthly contribution, technically under COBRA, you can continue that same monthly contribution, but there's not much of a tax advantage to doing that. So short answer is you would not contribute to it on your own.
Are these accounts invested? Are they just a savings account? What sort of, how's the account held? I think you mentioned in trust or kind of early on in the conversation, but I'm curious what control a person might have over how the account could grow or shrink.
Yeah, so there are some investment options. There are some pre-mixed portfolios. So there's 4 of those participants can choose from. And then there's some individual asset classes where they could build their own portfolio. So if somebody wants to invest more conservatively, just kind of, not have the ups and downs of the market, you could do that. Or if you wanted to invest a little more aggressively and, maybe have the ups and downs of the market, you could do that as well. There is a default fund. So whenever an employer enrolls someone, automatically their funds are going to be in the conservative premix portfolio. But they can always go in and change that. So you can make changes once per calendar month. And if employees or retirees are curious about what the different funds are, what the returns have been, They go to their plan's website, which is either VEBA.org. So for state agency, school district, and higher ed, that's VEBA.org. And then HRA for cities, counties, and special purpose districts. So we list all the investment options and what the returns have been in the past.
That's great. And then can you talk a little bit about, I believe I understand that it's not like a use it or lose it program. Back to our previous example, say I'm retired, I have this account now of $16,000. I don't have to use that money right away, right? I could just keep it for later and kind of let it grow within the portfolio, right?
Yes, that's correct. There's no time frame on using the account. So some people retire, they start using the account right away. Some people might let it sit there for a few years and then start using it. Or for employees who have an account as an active employee, some start using it right away. And again, some say, I'm not going to touch that until I retire. So really, the account's going to stay with you until you exhaust all the funds. So that's true. You leave the state, leave the country, but the account stays with you until all the funds are used up.
That's great. You mentioned early on in the conversation, I think, that this is a tax advantage account. So if a person uses this money to pay for a medical expense or to cover their premiums or meet their deductible or something like that, is that then taxable income? Could you explain a little bit without giving tax advice to folks, but just how that process works?
Yeah, so the VEBA, it's fully tax-free. So the money goes in tax-free or pre-tax. It could grow tax-free with investment earnings. And then as you pull the money out, that comes out tax-free as well to cover healthcare expenses. So I know most people hear, or they think of the term tax deferred more often, where you're deferring income tax. But with VEBA, it's not taxed ever. So it's tax-free versus tax deferred.
That is helpful context. I think you're right. A lot of us are used to thinking tax deferred, and so really tax-free is a bigger bonus. So that's great.
Yeah. And then when folks do go to use the money, can they just use it for themselves, or can they also use this money for their spouse or their children, right?
Yeah, they can use it for themselves, their spouse, and their dependents. And dependents include adult children up to age 26.
That's great. And then maybe if you could talk a little bit about the logistics of once people go to use the money, do they have to file a claim? Is there a benefits card? All of those kinds of logistic questions.
Yeah, so the answer is yes, and yes. So lots of different ways to use the account. I think the easiest way, in my opinion, is to set this up as an automatic premium reimbursement for ongoing insurance premiums. So you would pay the premium yourself, maybe out of your pension check or bank account, and you can set up your VEBA to automatically reimburse yourself for all or for a portion of those ongoing monthly premiums. So it's nice because you can set it up just once, and then VEBA can just automatically send you that money each month. When you initially set that up, you would need to provide some documentation that shows what your monthly premiums are. So whether it's through Healthcare Authority or whether it's a Medicare supplement plan, a Medicare Part B, you can set that up and have VEBA automatically reimburse those premiums. There is a benefits card as well. So this is a great way to pay for things like your co-pays and your prescriptions, where you just swipe the card to pay for that expense. We do tell you to hold on to your documentation just in case, because there are some scenarios where we need to see that documentation, and we would let you know right away if we do need to see that documentation. But you can also submit claims. So you can submit those online or through a mobile app or paper form if that's your method of doing things. But you would show some documentation that shows you incurred that expense. So something like a explanation of benefits or EOB from the insurance company. That's usually the best form of documentation to send in when submitting a claim.
That's awesome. I'm glad that they make it super easy. So there's an app, there's the benefits card, just to be able to use that money and, like you said, just track your expenses and just in case anything ever comes up.
So, Brian, you mentioned a couple of websites earlier on in the conversation, but could you just remind our listeners if they have more questions about what these programs are, how they work, what the investment lineup would be like, anything related, where they would go?
Yeah, so for if you work for a state agency, school district, or higher ed, you go to VEBA.org, VEBA.org. And then if you work for a city, county, or special purpose district, like a fire district, a port, PUD, you go to HRA.org.
Gotcha. And of course, ask your HR department.
Yeah.
Yeah, exactly. They know all the answers too. So definitely, you can check with them.
Great. Thanks for joining us today, Brian.
Yeah, thank you so much.
Oh, you're welcome. I appreciate it.
Thanks for listening, and now we'd love to hear from you. What topics would you like to hear about? What questions do you have for us? Send an email to drs.podcasts@drs.wa.gov. That's drspodcasts@drs.wa.gov. The Department of Retirement Systems provides this podcast as a public service, but it's neither a legal interpretation nor a statement of DRS policy. References to any specific product or entity do not constitute an endorsement or recommendation. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Views and opinions expressed by DRS employees are those of the employees and do not necessarily reflect the view of DRS or any of its officials.